You clicked on this video. Good. That means you actually want a real answer. Not embarrassment, not judgment. Millions of people Google this question at 3 a.m., lying in bed, staring at the ceiling. And not a single doctor will say it out loud during an appointment. I will. I'm a woman. I'm a doctor. And I'm not ashamed to talk about this openly. No fluff, no moralizing, just medicine. Let's go. First, let's talk about what actually enters your body. Because most people assume sperm is just sperm, one thing, one substance. That's wrong. What we call semen is actually a complex biological fluid. Sperm cells, spermatozoa, make up only 2 to 5% of the total volume. That's it. Everything else is seminal plasma, water, fructose, which is literally fruit sugar, proteins, zinc, magnesium, vitamin C, and several enzymes. Biochemically, semen is closer to a sports drink than anything dangerous. The total calorie count is around 5 to 7 calories. It will not affect your diet. I know that sounds strange, but that's pure biochemistry. Your body doesn't react to this as something foreign or alarming. It reacts to it the way it reacts to food. And that brings us to what actually happens next. So you swallowed. What happens in your body over the next few minutes? Your stomach is a highly acidic environment, pH around 1.5 to 2. To give you a reference point, that's similar to a mild hydrochloric acid solution. Everything that enters your stomach, proteins, fats, carbohydrates, gets broken down completely and without discrimination. Sperm cells are no exception whatsoever. Sperm cells die in stomach acid within seconds. They are not swimming anywhere. Your stomach and your uterus are completely separate anatomical systems. There is no connection between your digestive tract and your reproductive system. After breakdown, everything gets absorbed the normal way. Proteins split into amino acids and enter your bloodstream. Zinc gets distributed to tissues. The rest is processed and eliminated. Your body treats this entire event as an ordinary meal. Nothing more, nothing less. The one real medical exception worth knowing: sperm protein allergy. It's rare, but it exists. Symptoms include burning, localized swelling, itching, and in severe cases, anaphylactic reaction. If you've ever experienced unusual symptoms after oral sex, that's the first thing to rule out with an allergist. Not embarrassing, just medicine. Now here's the part of this conversation that actually matters most. Because semen itself causes no harm, but it is a biological fluid, and biological fluids carry pathogens. As a physician, I have a professional obligation to say this clearly. HIV is present in semen. The risk during oral sex is low, but it is never zero. Any open sore, bleeding gum, or cold sore in your mouth changes that equation significantly. Throat gonorrhea is far more common than most people realize. The reason it goes undetected so often is that symptoms are minimal or completely absent. Women come to my office with an unrelated complaint. We run a standard panel, and there it is. Gonorrhea of the throat, undiagnosed for months. Herpes simplex type 2, hepatitis B, and syphilis are all transmissible through oral contact. I am not listing these to frighten you. I'm listing them because this is information you deserve to have, and that most clinical environments are too uncomfortable to provide. A condom during oral sex reduces transmission risk by 80 to 95%. That one simple barrier changes almost everything. That's not opinion, that's data. The practical takeaway is straightforward. Both partners should be tested for sexually transmitted infections at minimum once per year. This is not a shameful act. This is standard hygiene, the same category as going to the dentist. If you have any doubt about your partner's status, use protection. No drama, no conversation required. Just a decision you make for yourself. Now let's clear up the myths, because there are many and they are stubborn. Myth 1. Semen is beneficial for your skin. There are zero, published clinical studies supporting this. It is a marketing narrative and an urban legend. Please do not put it on your face. Myth 2. You can get pregnant by swallowing. Anatomically impossible. The digestive system and the reproductive system do not connect. This is not a debate, it's basic human anatomy. Myth 3. Regular oral sex reduces nausea during pregnancy. This one is actually partially supported by research. Dutch scientists published studies on immune tolerance, the idea that repeated exposure to a partner's antigens may reduce the immune system's rejection response during pregnancy. It's a real finding. It is not a medical recommendation. It is, however, my favorite fact to mention at dinner parties. Myth 4. Diet doesn't affect taste. It absolutely does. Pineapple, citrus fruits, and high water intake produce a noticeably sweeter result. Alcohol, red meat, cigarettes, and garlic produce a bitter, sharper taste. This is documented biochemistry. Pineapple works. I have had enough patients confirm this over the years that I now consider it clinically anecdotal evidence. Pass it along. So here is the complete picture. If you swallowed, from a purely physiological standpoint, your body is fine. Your stomach handled it, processed it, and moved on. The conversation worth having is about infection risk, and that conversation has a very simple answer. Get tested regularly, use protection when there's any uncertainty, and treat your sexual health the same way you treat every other aspect of your health. You deserve accurate medical information without shame attached to it. That's the only reason this video exists. Share it with someone who needs it.